This is a lunchtime talk. I hope you already have had a nice lunch. Today we have Mr. Maximilian Kressner. He is a visiting fellow of the Center for Comparative and Public Law, and he's working on a PhD in public health law at the Max Planck Institute for Social Law and Social Policy in conjunction with the Ludwig Maximilians Universität in Munich, Germany. He specializes in comparative public law and medical law and ethics, so presumably that's why I'm chairing this session. His research interest is in the area of public health law, promotion and disease prevention, with particular focus on the constitutional restraints on public health interventions and protection of individual liberty and personal autonomy, and the right to health in international law. For today's talk, we'll consider the reasons and justifications for public health promotion policies, including duties and obligations that arise from international law and the right to health in particular. So before saying any more, I think we will just let Max have a say. Thank you.
Thank you, Terry. And special thanks to the people that have no personal or official obligation to be here. Yeah, so I was told that I have about half an hour for the presentation, and then we can have a discussion later. So I try to stay within the limits of time. Obviously, I have lots to say to this area because it's a vast area, a lot of interesting questions that are involved. So I think, yeah, I just give you an overview. So the topic, public health promotion as a challenge to personal autonomy. It's a very vast area, I think I give you a quick introduction into what actually public health promotion is about, why states, or why we should generally have an interest into promoting public health, how we can promote public health, and then we come to the point that what are the challenges to personal autonomy and how can they be justified from my perspective. So a quick introduction to what is public health promotion about is the perspective of public health is it is really concerned with the health of societies in contrast to just the health of individuals, right? So the medicine or medical system, healthcare system usually focuses on the individual curative treatments in clinical settings, right? So it's about medical treatment, whereas the public health approach is that public health actions aim to protect and promote the health of entire populations by using interventions that aim to address the underlying determinants of health and disease. So this is still very abstract definition, so we will have a closer look into what it is about. So why should we promote the public health, right? So the ideas of public health scholarship is that health is determined by multiple factors. So as we can see here, it's very a large area, and multiple factors such as age and hereditary factors, of course, but individual lifestyle factors play a role, the social and community networks, and most importantly, the general social, economic, cultural, and environmental conditions, right, that shape our health. So it's living conditions, healthcare services, it's education, work environment, right? All these factors have an impact on health. So, of course, the first point we realize is that health is much more than just healthcare, or healthcare services, where traditional medicine and also medical law is concerned, right? So, what I find interesting at the first observation, it is you can find very different accounts, and I discussed it with Terry over lunch, to what extent actually the individual factors play a role in your overall health status. So you can find studies that attribute a very big part to the lifestyle and behavior, like 50%, over 50%, they say, right? your health status is made up by your health behavior, smoking, obese, stress, etc. Environment and biology also plays a role, right? But in comparison to the behavior, just a minor part. And which all accounts agree, though, is that healthcare has only a very minor impact in your overall health status. So health status also meaning, right, your life expectancy and also the mortality of the population, right? And of course, I mean, it makes sense from how I will go to explain later. So, but you can find actually, and that's why I'm showing you a couple of these statistics. Basically, you can find any numbers, right? The longer you look for them, you can find very different accounts of to which extent, especially like lifestyle and behavior, which is my focus, contributes to your health status. So, right, here you can see that genetics, for instance, has 30% impact, whereas behavior goes down a little bit. Next statistic shows that the health behavior only is attributed 30% of your overall health status, whereas the socioeconomic factors and the environment, right, play a much more important role in this account. And it gets even better, especially in Canada and Australia. Apparently, they do not tend to attach a lot of importance to behavioral factors. So here you can see numbers like 20%, and what I found the other day, this information from the Canadian Health Services is, right, the account what makes Canadians sick. And if you have a look, you won't find any point saying that it's the individual behavior, right? It's your life, but this is basically lifestyle, like life conditions, right? Income, education, gender, employment, stuff like this, healthcare, services, biology, environment, right? So they, interestingly, apparently don't attribute too much to the individual behavior. So first question then is, why is the influence, or consequence question, why is the influence of healthcare services on the health status just of a minor influence, right? The point is that it's non-communicable diseases, NCDs, that are the major threat to health nowadays. Non-communicable diseases, so NCDs, are cardiovascular diseases and cancer, most importantly, chronic respiratory diseases and diabetes. And here's some numbers. So globally, 68% of all deaths are attributed to these NCDs, and in Europe, it's even 86%. China 87, up to 91% in Germany, where I'm from, right? So these NCDs play a major role in like the reason why people are dying. It's not that much of communicable diseases anymore these days, right? So, and the problem with these NCDs, of course, is that it's chronic diseases, right, and cancers, so they cannot be cured, right? So they will have an impact on the whole lifespan. However, and this is the point that public health and public health promotion is trying to focus on, is that NCDs are associated with well-established risk factors, right? So we can have here various risk factors that are usually attached with individual lifestyle, so high blood pressure, physical inactivity, obesity, alcohol, blood glucose, so tobacco use, cholesterol. Of course, they are all linked with each other, right? And the point is that these risk factors can be prevented, right? So through public health promotion and disease prevention. So that's the claim, right? Well-designed public health policies can improve the quantity of life years and the quality of life with attacking basically these risk factors and trying to make people healthier, right, with the aim that they don't even fall sick, right? So that's the idea. So apart from these factual reasons why we should promote public health, or why states should engage into promotion of public health, there are also legal obligations. Yeah, we can find, especially in international law. So there are various instruments, and I won't name all of them because I think this would take half an hour on its own. So I'm just mentioning briefly the two most important conventions that play a role. So first of all is the WHO Constitution, which is concerned with health, of course, defining health as a state of complete physical mental and social well-being and not merely the absence of the disease or infirmity. And they say that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, or social conditions. More importantly, there is also provision in the International Covenant on Economic, Social, and Cultural Rights, which is as an international treaty has a binding force to the state parties. And they also recognize that the right of everyone to the enjoyment of the highest attainable standard of physical and mental health, at least, is part of human rights. And they also acknowledge that steps, right, the steps that need to be taken by the state parties should include, among various other array of steps, also the prevention, especially prevention of epidemic and other diseases. So you can see, about the right to health itself, there is a lot of dispute what the normative content is actually about, whether it has more programmatic character, right? So addressing states and states' obligations to promote the health, or whether it's actually giving people enforceable rights to specific treatments, specific preventive measures. But however, it is uncontested that states have at least certain objective obligations, right? So state have to realize the right to health by means of respect, protection, and especially fulfillment. And one of these fulfillment obligations is to give sufficient recognition to the right to health in the national, political, and legal systems, and to adapt the national health policy with a detailed plan for realizing the right to health, which also includes positive measures, right, that enable and assist individuals and communities to enjoy the right to health. So it's very much about empowerment also, right, about individuals to make competent decisions about their health and to provide healthy living environments. So then a quick look on how the theory behind it, on like what are specific measures, right, we can think about and how to promote the public health. WHO says that health promotion is mostly the process of enabling people to increase the control over the determinants of health, right? You can do this especially when WHO focuses on 5 main actions that are concerned with building healthy, supportive environments, strengthen community actions, develop personal skills, and also reorientate health services, right, from the individual curative aspect to the more preventive aspect of health. But basically, I think we can sum up that it's mostly about social and environmental actions that should support healthy living conditions and that should enable people to make competent choices, right? So there's another way of showing this, of picturing this idea. So you have a lot of broad measures, structural measures. Education has a specific role, right? So these are all the ideas of how you should promote public health and the health of the individuals. So after this rush through the theory behind public health, I now want to come to the point where I see challenges to personal autonomy within all this sphere of public health promotion. And my claim is that public health actions, how they take place in legal reality, is that legal measures, despite the fact that they actually should address like structural points, is that they, in practice, they mostly address and are focused on individual behavior. So, and with this, they not only are contradictory to the idea of well-designed health promotion policies, but they also are an infringement of fundamental rights. Especially, they are a disrespect for people's autonomy. Why I see this, I will show you just after this slide. So, at least from this perspective, then, legislative measures and health promotion would require a justification, right? So compelling state interests, why the state should engage actually, apart from the obligations, but in the specific health measures they are implementing. Right, so my benchmark for the legal analysis of health promotion policies is to which extent they actually provide a respect for autonomy, yeah, and also to which extent they are non-discriminatory. So yeah, a quick account of autonomy, which also plays a role, and of course there are libraries about different accounts of autonomy, but the essence of autonomy is, pretty straightforward to say, is that it's about self-determination, self-government. So it means that an autonomous individual acts freely with a self-chosen plan, right, according to its own standards and ideas. And at the minimum, and this is enough for this quick overview now, is that personal autonomy encompasses self-will that is free from controlling interference and other limitations that prevent a meaningful choice. Yeah, so as would be the case in lack of complete understanding of the situation or the decision that is at stake, and in cases of manipulation, right? Because if an individual is manipulated in the way they shape their beliefs, their actions, then it has not a true self-control over its own choices. So, then one difficulty, I think, which is part of my research, is that actually it's not that easy to find the idea of protection of autonomy, which you can trace back to a specific fundamental right. And I say this because in national laws, also international law, fundamental rights are usually, and human rights are about actions, liberties, right? They protect specific behaviors, right? And the problem with public health measures is, as we will see, is that they not necessarily prohibit specific behaviors, right? Like smoking laws that prohibit smoking, but they much more try to influence your behavior by less restrictive measures, right? By information, by pushing you towards a specific direction with different other strategies. So they basically try to attack your mind, right? And not so much your freedom of choice. And but as I just said, for me, autonomy is also about respect for the self-determination. So it also should provide protection against the manipulation of the mind, right? So. And at least in the German constitution, you can attach this to Article 2 of our basic law, which provides a general right of personality. So it also includes a respect for dignity, human dignity, and basically can be used as for this idea that your creation of the will somehow shouldn't be something that the state should interfere too much. But we can also find it in international law, as just mentioned, the right to health, which not only provides obligations to the state, but also the right to everyone to control one's health and body, right? So self-determination about your health. So now I'm just going through what I call a legislative toolbox. So we have a look at a specific, that gets a bit more concrete, because I think it's still a bit abstract, a bit more concrete what measures I have in mind and what legislators are planting into practice. It will be basically these 4 categories, which is quite a standard categorization of legal measures from the German public law perspective. So first of all, we have duties and restrictions. Then we have incentives, which are mostly economic incentives. Then we have a so-called concept of nudging. I will explain this when we get there. And also communication, which is basically about information, but as we will see later, information can also become manipulation, so that's why the category I call communication. And our guiding question will be, what distinguishes autonomy undermining influences on a person's decision, intention, or will from those that only motivate, and play a role in the self-governing process, Because it's a fine line between, on the one hand, as I said, autonomous person needs to be competent, therefore they need to have knowledge about, right, what the impact of the decision, right? So on the one hand, they need information, but on the other hand, there's a fine line between when information becomes manipulation. So classic measures for every legal interventions are, right, duties and restrictions. And what can you think about in public health? It's the obligation to wear a seatbelt, right, which is meant to go to your health, click it or tick it. Actually, it was quite fun to look for pictures for this presentation, and I think this topic is perfectly perfect to find a lot of pictures, but it's not that usual for legal presentations. So, seatbelt laws, right? Very long established. No one would question that much anymore. Seatbelt laws nowadays. It gets a bit more disputed when we talk about bicycle helmet laws that make it obligatory to wear helmets. And I see no difference between a seatbelt and a helmet, but for helmets, I think there are not a lot of countries that have actually mandatory to wear a helmet while you're riding a bike. And of course, we have the most traditional example of smoking laws, right? Laws that prohibit smoking in specific areas or in public in general. We also have obligations, the example of mandatory vaccinations, which I think is a highly disputed area. Yeah, so it varies between countries. Like it varies a lot, like whether there are actually vaccinations are mandatory or not. Yeah, and you can find these great pictures and posts of opponents that, yeah, say like mandatory vaccine, you know, like draw these very grim accounts of what it means to personal autonomy and to children when they are forced to be vaccinated against diseases, right? So if we have a look at the duties and restrictions, I mean, these are traditional measures, right? So they limit the freedom, but not necessarily autonomy, because autonomy does not mean, right, that you can do anything you want to do, but it's basically that you can still choose, but within, of course, some kind of framework, right? In a society, we have to live together. So there are some restrictions, but these are more restrictions, external restrictions, than actually interfering with you choosing or not to choose to comply with the law, right? And justifications for these are traditionally straightforward, like protection of third parties when it comes to smoking and vaccination, so that makes it somehow easy to justify these strict measures. But I think if we have a look at like safety belt and helmet laws, it becomes a bit more questionable what is actually the state interest in these laws, right? Because if it's about protecting people from themselves, right, to self-damaging behavior, of course this depends a bit on the account, but usually I would say in this traditional Western account of individual freedom and individual rights, this is not a legitimate aim of the state, right, to protect people from themselves, because it's a very paternalistic idea, right? Yeah, so the next step would be incentives. And incentives can be used. This very much depends, though, on I would say on the national systems. But I only found this in German, so it's a bonus program. It's not too different from English, though. So what we can find in Germany is that there is a trend. In Germany, everyone it's obligatory to be insured with a health insurance company, like privately or state. With the state around sickness funds, whereas 90% are insured by state insurance, so public health insurance. However, they provide bonus programs for healthy behavior. Yeah, so if you participate in specific, like if you are enrolled in a gym, if you participate in healthy nutrition workshops, healthy physical behavior workshops, etc. Like this, you get, it depends, but you get basically either you get a deduction from your, so it's not framed like this, but you get a bonus, right? You can get it in cash, or you get like tools, whatever, computer, whatever, at the end of the year. And of course, people wouldn't frame it like that, because legally it's forbidden to like, when in the public health insurance, to make your contribution dependent on your health status. Right? on your specific health status, because the idea is that everyone should be covered in the same way. You have to say, like, with the contribution dependent on your income, but not on your health status, right? Whereas this actually provides somehow a bit, and you can also see it like incentives where you have healthy people get benefits, right? Basically means that unhealthy people have to pay higher contributions because they don't get benefits. And usually these are combined with this I found in Hong Kong here, so I try always when I find something in Hong Kong, I try to combine it with sharing your health records, right? So what health insurance companies also try is they subsidize wearables, so these, you know, the modern like smart watches, etc., that can monitor like your health status, like how much you walk during the day, you can how much food, what kind of food you have, etc., and you can voluntarily share this with your health insurance company, right? So they can like monitor whether you actually comply with the bonus program. And this, of course, among other reasons, is also questionable in terms of data protection, because up to now they say that they won't, I mean, right, data is just there, but no one will draw any consequences from these data once they have it. But I mean, it's always like this, right? Once data is collected and it's there, someone wants to use it, right? It's just so close. So, yeah, but also then you have the traditional negative economic incentives. Tax, usually alcohol tax, but also, which is quite new, like a trend to sugar tax. They just discussed this in the UK to introduce a sugar tax. So meaning that on specific, especially it's aimed for beverages, right, soda. So specific amounts of sugar are taxed differently. And I found quite an interesting comments on Twitter here for this when I googled for sugar tax picture, which are quite interesting because I think they somehow summarize the ideas behind all this, right? So one says, there's no justification for any form of sugar tax. Healthy people should not be punished for the sins of those who can say no to cake. Okay, that's one specific account, but the more very more reasonable statements are this, like, why tax on sugary drinks rather than campaigning for access to sports and exercise facilities? Swimming used to be subsidized. Or sugar tax. We don't need a sugar tax, we need cheaper, healthy food, right? So, yeah, if you take this into account, right, also with incentives again, they just increase the costs for specific behaviors. So also from this point of view, they are not really a threat to autonomy necessarily, but they can, however, depending on the circumstances, but also create social pressure, right, to follow healthy behavior, because if everyone amongst your friends is doing this because they get benefits, then you're somehow pressurized to follow this as well. But the problem I see with incentives is, if they are done like this, is that they actually advantage people that already behave healthy anyway, right? Because it's also that most people usually wouldn't subscribe to a gym just to get 50 euros reduction of the health contribution, but it's the people that are subscribed in the gym anyway that even get the bonus for that. And the point is that measures like taxes, right, they put even higher burden on the socially disadvantaged people, because it's mostly people that are less well off that buy like unhealthy food, right, which contains high amount of sugar and fat, etc. And if you tax it, I mean, doesn't mean that healthy food becomes cheaper, right? It just means that their unhealthy food becomes even more expensive, right? So I think it's very critical from a discrimination and equality point of view, because it might actually even increase health inequalities instead of reducing them. And here again, justification for such measures is again, right? I mean, it's making people healthier. Is this a compelling state interest? Or is it paternalistic? So then we come to the mysteriously sounding concept of nudging. Nudging is a, some people say it's not necessarily a new category of regulatory instruments, but basically it's a concept which two Harvard professors came up with a couple of years ago, and they published several papers and books about it. So it's a very highly discussed new approach to regulate people. And what it's about, nudging, is basically a concept that is based upon behavioral science and economics. Yeah, and it argues that positive reinforcement and indirect suggestions can influence the motives, incentives, and decision-making of groups and individuals as effectively, and if not even more effectively, than traditional instruments of direct instruction, legislation, or enforcement. So, still a bit abstract. A nudge, basically, is any aspect of the choice architecture that alters people's behavior in a predictable way without forbidding any option or significantly changing their economic incentives. To count as a mere nudge, the intervention must be easy and cheap to avoid. Nudges are not mandates. Putting fruit at eye level counts as a nudge, banning junk food does not. Yeah, so basically the idea is that we found out that all these restrictive measures, taxes and laws forbidding stuff, is not very effective. So this idea is that people have limitations, restrictions, cognitive restrictions, and a lot of everyday, day-to-day behavior is basically automatic behavior, right? People don't think about it. That's the idea. They just do it. Yeah, because, so for instance, as we can see here, examples for nudges. Nudges are like putting healthy food more prominent than unhealthy food, because apparently research shows us that just the mere presentation, like the way how the food is presented, right, whether the apples are in front and the chocolate bars are hidden away, apparently can increase or decrease the amount of specific food like being purchased by 25%, right? So, and this of course like suggests that actually people do not want the food because they want this chocolate bar. They just want it, or they just take it because it's there, right? It's easy, it's like obvious to take. So whereas you would change all these, that's what they call choice architecture, so whereas you just change the environment in a way that makes people behave healthier automatically, so they don't even have to think about it, right? Same goes with, I still don't understand this that well, but apparently it depends on the way how you present specific drink sizes. So apparently people tend to always take the second, the second size that is presented, right? So it depends on whether you start with super large, small, normal, and then you take the second largest. But if it's just presented the way around, then you take the second smallest. So also in this way you can shape the behavior. So also you could exchange candy machines with fruit machines and vegetable machines. That's the idea. And you find it also here, HKU, the Green Monday. I don't know if a lot of people are aware of that, but I talked to some friends, they didn't know about that. But the Green Monday, right, it's basically nudging, right? It puts on Monday, so a lot of restaurants have subscribed to this idea. On a Monday, they just highlight basically the vegetarian options they have in the menu, right? So it's nothing like they don't have a bigger choice anyway, but it's just highlighting with this separate page in the front, Green Monday, so put the healthy food in the front, and so the assumption is that people will take the healthier food just because it's more obvious now, right? So, then the question is, okay, are these nudges affect autonomy? The people that put forward this idea, and especially governments, they're very interested into that because they can somehow secretly steer people into a specific direction without them even knowing that they are regulated, right? So they're being regulated. And so governments, and Thala something that the two professors that came up with the idea said, no, they do not limit choice, right? Because you can still choose to take the unhealthy food, to take the elevator instead of the stairs, etc. They just say they only alter automatic behavior, and since automatic behavior is not an autonomous behavior, it doesn't matter, right? So basically you can do whatever you want to do with it. And I think that making use of these arrows, like there's the limits to your limitations to your cognitive abilities, is definitely not fostering competent decision making, right? It's actually manipulating people the same way, right? Because you make use of processes that people are not even aware of, right? So I think that also it's somehow determines an objective standard of what autonomous decision entails, right? Because the traditional justification is also that in the long term, everyone wants to be healthy, right? But people are just too weak to enforce this, like in political fields, it's called like second order desire, so this long-term desire to enforce it in everyday decisions. So the government just helps the people. So meaning that if someone wants to be unhealthy in a specific way that actually conflicts with their long-term interests, since everyone wants to be healthy, so no one wants to eat chocolate, no one wants to not be vaccinated, no one wants to smoke, right? That's the assumptions. So we're just helping people to behave how they want to behave anyway. That's what people put forward to justify these measures, whereas I think, right, it's part of autonomy to determine yourself what your desires and standards are and whether, like, to which extent you behave actually reasonable or not. And here again, right, justification is that making people healthier even without or against their will is not a very compelling state interest to my point of view. And then we have communication measures, also very traditional in health promotion. Well, here also just show you some different pictures, and you can decide yourself maybe to which extent you think when information becomes manipulation. Yeah, so we start with traditional nutrition facts to highlight even like a bit more adapted version already to highlight the nutritious facts of your food, like coloring it according to what you need, what is unhealthy, stuff like this. Here, this I found in Central the other day. A poster indicating, right, how much exercise you need to do in order to burn 150 calories, and then on the other side they show you how much calories you take in with junk food. Yeah? So very informative, right? Also eating less junk food, doing more exercise. So then we also have here, which I found at university, get healthy, save the earth, take the stairs. I just discussed it with Perry when we were taking the elevator. We were not being very healthy, and I think this is, I find this just hilarious, because not only, right, that you stay healthy, you also save the earth with taking these stairs, which I think is a bit, I mean, of course, right, it's the goodwill, but I think that the way modern economies are designed is much more having an impact on environment than people taking elevators instead of stairs. But anyway, feast on these, not on these. I also like fast food. Here, another example, but it's all over the place, and this is the interesting part when, like, once you're concerned with this, you see the public health nudges and promote everywhere, right? So this is another example. It's let's give our children the best support, sustained breastfeeding, right? Also a health behavior, which the state is trying to put forward, of course with a good idea, implication that breastfeeding is healthy, but then it's like it's all over the place. So, and then of course the traditional warnings on cigarette packages, right? Where I think with this extent it far exceeds the point of neutral information, and it's just threatening, basically addressing emotional threats. So it can accelerate aging of skin, which is interesting, right? Because it has more actually addresses like beauty than health, right? Smoking kills, very straightforward, harms your family, like this. And in with regards to this, I also found a nice picture which will come now in a German satire magazine. They just made this mock press release that the European Union is now planning to introduce a new bill which makes it mandatory to tobacco salespersons to basically look like the Grim Reaper. So people are even more I'm more afraid of, and more aware of the risk that is related to tobacco products. So, and here I guess, right, the difficult thing with information is that everyone would agree, right, that information is the key to autonomy and making competent decisions. But I think, I hope, as I was trying, of course it's a bit exaggerating, but that at some point there's a difference, right, between addressing people as reasonable human beings that are competent of making their own choices, right? Giving them neutral information, in contrast to use suggestive and manipulative techniques, which certainly these, I think, to some extent, in especially the smoking publications is reached, is that they actually do not foster competent decisions, right? I think they rather hinder competent decisions because they do not address reason, they address emotions, right? So my conclusion so far is that public health measures that target individual behavior and lifestyles tend to, like the way they are done, right, in reality, in real life, are that they tend to disrespect autonomy and interfere therewith with fundamental rights, and which is still okay, right, as long as the state has a proper justification for that. But justifications, right, which we saw, which would derive from the actually obligations, is to empower competent decision making and to focus actually on structural measures instead of just targeting individual behavior. I think all the measures I have shown do not really comply with this, right? They are not really empowering the competent decision making. They are not really reducing health inequities like taxes, right? They rather have the tendency to increase health inequalities. Also, it's questionable whether making people healthier, when we're discussing this, is actually, and it's a difficult topic, because making people healthier is ultimately leading to the idea of making people better, right? Better people. And I don't know whether making people living, making people better people, to whatever account better people you have, the idea you have of what is a better person. I'm very doubtful whether this is a legitimate aim, whether this is a compelling task for the state to engage in this. So, but there are more options to justify it. But as I said, is that somehow the state needs to improve the public health, though. And this is what I'm still doing my research on, is it's difficult actually to especially in the Western world, I think, to find an account where you can have like public health as a group interest, right? So, and the question is, what is actually, is there more to public health than just the health of all, like the sum of all the individuals, right? Because if you see that like making the individual healthier is not really a legitimate aim, is it then becomes legitimate if you just make everyone healthier, right? And also the question, right, to which extent an individual has accepted restrictions to his health behavior in order to foster the health of the overall population. So yeah, this is still ongoing research. So, okay, a bit longer than half an hour, but thank you very much for your attention. And,
thank you, Max.
Yeah, thank you.
We have time for some questions. Would anybody want to start the ball rolling? Yes, if you could identify yourself.
I'm Mary. I'm a psychologist, and I'm interested in your concept of nudging, which to me is a very old. I mean, conceptually, it's about marketing, right?
Yeah.
And nowadays we are all everywhere, infiltrated by subtle suggestion about purchasing, and then all these marketing strategies and advertisements are already existing, and so by nudging, I think, I mean, from the government side, I mean, government has more resources, right? But versus corporate also have a lot of resources to manipulate our minds. It's every day, right? So would it be really the more in deeper thinking is really, it's about raising our consciousness about what we are being, how our decision making is affected by all these environmental influence. But still, no matter how mindful and conscious we are prone to suggestion. So it's about raising awareness about what kind of information are really valid and how it impact on our daily healthy behavior.
Right, and then that's the point. What I also think is that, right, of course, the argument is, I mean, the companies are using its marketing strategy.
All the time,
right?
for decades.
Companies using it all the time, right? So that's the argument. So if the big soda and tobacco companies are basically making you smoke and making drinking you like unhealthy drinks, highly carbonated and sugar drinks, why shouldn't the government use the same strategies to change that behavior, right? But as you said, I think the government has a different obligation, though, right? Either it should regulate then the companies, right, and restriction in their marketing, whatever, or then it's about education, right? That make you aware how these strategies function actually and how they can manipulate you, right? I just want to show that I don't think that the government should make use of this manipulation because this is not the way how, from my point of view, the government should address and should address its citizens, because it should treat it with respect for autonomous and competent decisions and not making use of their defaults and limitations. Yeah. But it's very interesting, and actually, just dealing with this topic makes me much more aware. As I said, right, I'm seeing now all this. All these little nudges all over the place, right?
It's propaganda, right?
Yeah,
From the government side.
basically it comes to this point.
For corporate, it's about advertisement.
Yes, but it comes to this point, right? To which extent it actually becomes propaganda, but also to which extent there is a legal protection against propaganda, right? Because on the other hand, it's just propaganda is just like influencing your mind, right? So to which extent is your mind protected by the law? It's not that easy, I think.
I wonder if I may just expand on Mary's point. I might get to think that people are much more resistant to manipulation than you might argue. And I think that especially if it is identified as government propaganda, people will be highly resistant. So and I think that my own point of view is that we have to give people rather more credit for their ability to make decisions on an autonomous basis than that we might give them, that we might think that they otherwise would have. People seem very clearly able to ignore very compelling public health messages and very clear disincentives. For example, smoking. Right? If they want to smoke, they have to smoke, despite the price of, despite the taxes you may levy, despite the awful pictures that you may stick on the boxes. So to me, I don't see this as interference with personal autonomy. I see it as, well, if you like, communication, albeit in aggressive form, but you are dealing with a very aggressive and highly addictive behavior, which to me, I think governments do have the obligation sometimes to present the arguments in a very forceful way. Right? I think that the fact that people still smoke, despite these clear examples of propaganda, people still drive without the seatbelt, despite clear propaganda, is evidence that, in fact, most people are not moved as far as decisions, making autonomous decisions are concerned. But that's my own viewpoint.
And just to address this quickly, and I'm right? I think this is good to some extent, but what I was trying to show with the theories, like the public health theories in the first place, is right that actually the overall impact of your health behavior on your health status, right, on population health, it's highly disputed, like to which extent it actually has an impact. And I think, like, the more I think about it, right, initially I also started from the point, because if you just read that, like, the public health literature is very much influenced by medicine, right, and of course they are, for doctors there's like no limitations to what they can do to how to make it obligatory for people to be healthy, right? For them, they would restrict everything that is unhealthy, right? Immediately, alcohol, sugar, tobacco, etc., right? But then when I think about it, I think isn't it much like doesn't the way our world is shaped like, you know, living and working conditions, right? That people work, especially in big law firms, right? It might be a bit more personal experience, but the people can just work, or somehow are also forced to work until they basically die 14 hours in small offices with no window. From my point of view, this certainly makes you more unhealthy and create habits, right? Stress, coping habits like smoking, etc. So this is actually the reason in the first place. So why should you punish people for, and also constantly nagging them about, oh, this is your own fault if you smoke, etc. So smoking is a difficult example because, of course, right, I accept that it's a very, and I don't like smoking at all, and I hate if people are smoking, right? So I'm actually a very fan of regulations that forbid smoking in public, at least. But it somehow comes to the point where, if someone wants to smoke at home, what is the point of it, right? There are so many behaviors that can also equally be a threat to health, right? No one has a problem with people engaging into parachuting and skydiving and dangerous sports, in working 14 hours a day, in living in cities where there's a high air pollution, where you have the exhaustion of all the cars, etc. No one has a problem with that, right? But and to my point, it just seems to become a bit arbitrary to what behaviors we pick out to demonize in a certain way, and and it usually tends, and that's the point, it usually tends to be behavior which is a typical lower class behavior, right? If you have a proper look on this. So, but sorry, yes.
Yes, Mike Palmer from London. I wonder, developing those arguments, then, there surely is a case for compulsion, however temporary, so that people are educated into better ways of behaving, and that compulsion can then be relaxed, and people can regain their autonomy. I think in certain aspects of procedural law, mandating certain kinds of behaviour has an educative effect, and people learn that there is a better way. And it seems to me that's something that could be applied to public health. Secondly, so far you talked in very broad terms about government, but I think health bodies in certain parts of the world, at least the statutory bodies which are set up by government, are actually independent of government, and therefore have a degree of autonomy in the kind of advice that they give to people. So I think some of your strictures, it's a bit to government and the individual citizen. I think the picture is a little more complicated than that.
Yes, I think that, but this is very specific, I think, to national, to national law and to the way how, right, the system is structured. Because from my German perspective, it's about regulation. Because everything, like as you said, the statutory health, like insurance, is basically, right, acts upon law, right? And of course it has a discretion, but it cannot act without any legal grounds, right? So ultimately the government shapes all the policies in a civil law country like Germany, right? So that's the point. I mean, so it's a big, like public law and like administrative law plays a major role. So the legislator can mandate the health insurance companies what they do and what they don't do, right? So, and at the same time can also impose restrictions and limitations, right, on the way how they do their business. So that, of course, it's a limited perspective, but since this is due to my legal background, right, so the constitutional tradition just in Germany.
And how about compulsion?
I mean, there's no like one answer, right, to this. So it's a very, as I said, it's difficult because I also see, right, that to some extent it's an effective and also maybe necessary way of educating people. But then also, which I haven't engaged in, is, I mean, health is also, if you have a closer look, right, I mean, what is health about, right? So, I mean, all we're talking about is very much focused on two factors, basically, on living long, right? So it's a very like biological account of health, right? So being healthy means that you live as long as possible and that you can basically engage with society as long as possible, right? But I mean, who says? It's just as a point of discussion. Not that I am fully convinced by that, but I mean, who says that it's not healthier in an account of health that also takes into account like happiness or like satisfaction when eating cake? I mean, if you want to eat cake and smoke every day, but you go from this earth with 40 years, then who says this wasn't a healthy life, right? I mean, who that's the point. I mean, what is the government to determine ultimately that healthy means everyone has to be somehow live an ascetic life, right, with no pleasures and no sins, with the ultimate goal to be to live until they are 100 or even older, right? And then also okay, you can have the argument, Terry and I had this during the lunch, that okay, you can be unhealthy, but it has an impact on other people, right? Because they ultimately have to pay the costs, right, for your unhealthy behavior. But then also there are a lot of different accounts of and like calculations of what is actually more expensive, right? Are smokers more expensive to the society, or are healthy people more expensive? And there you can find studies that say that actually smokers are cheaper to society because they die much earlier. And what they die of is cancer, right? What they die from is cancer. And cancer, I mean, everyone at some point ultimately dies from cancer, right? And the point is, the treatment of cancer actually costs more or less the same in your last life year. And so, but if you pass away 20 years earlier, then it saves a lot of money for the pension funds, for the caretaking services, etc. I mean, I know it's argument that is a bit ambiguous, but right still, I mean, it's just, I'm saying that there are so many different views on this that it's not a straightforward answer, so I'm questioning to which extent it should.
The smokers also been paying cigarette tax.
Yeah, that's the point. No, with the tobacco tax, actually, right? You're making a lot of, you're creating a lot of income.
But your general point is important in another sense, namely, with an aging population, society maybe has a longer or stronger interest in people maintaining a healthy lifestyle, so they're not such a burden on others. And in the United Kingdom at the moment, I mean, that's a serious problem. The National Health Service costs are skyrocketing because people are living longer, but not necessarily very healthily so. So I think the social interest is something you have to take into account, yes. Which is why I would favour compulsion in certain areas. This, by the way, is precisely the unhealthy room we spoke of a moment or two ago. Windowless and airless.
Yes.
We have time for one more question. Yes, please.
Hi, I'm Jane. I'm doing a PhD here in the law faculty. I'm wondering if you think there is a kind of legitimate way of supporting people to make more competent and self-autonomous decisions.
Yes, there's definitely, right, as I said, I mean, it's all about education and information, right? And I'm not saying that information is a bad thing, right? But I'm just wanting to point out, right? And of course, I haven't found the ultimate answer, right? And that's the big point, right? How it's, of course, it's necessary to make people more competent, but what research tells us, right? It's about, as we discussed, right? If someone is living from social benefits, for instance, right? I mean, it's not only that they do not have enough money, and not they might, not even have the education. It's likely that they don't have the education, right? So they maybe don't even know what impact food has, right, on their health. But it's not only that, right? It's that healthy food costs more money usually, right? Well, not necessarily, we discussed it also, right? But then on the other hand, at least then it might be a way that, of course, if you're less well off, you tend to live in areas where a lot of people live that are less well off. So there might be no options to buy healthy food, even if you wanted to, right? So the threshold to go somewhere to a market, right, which is further away because the markets with fresh foods are where the rich people are, right? So you only have like the junk food all over the place, etc., right? So it's about these structural measures, right, that is public health is talking about, right, that it should be much more of a focus to shape like the society, right, in the way that that you have access to healthy living conditions in a much more equal way. And this is also what public health is much more concerned about. And of course, it's about education. But then again, right, I mean, the assumption is that when everyone is educated enough, then you would automatically behave healthy in a specific account of health. There might be different accounts of what is important in life and what, to which extent health is just biology or much more.
Well, thank you, Max. Will you please join me in thanking for this very interesting topic?